That's it.
We are good to start, ma'am.
Hello and welcome in today's nursing webinar session, as we are going to talk about the heat stroke and hyperthermia management and its evaluation. As you all know, the onset of scorching heat has started taking a toll on the health, and TS releases the heat stroke safety guidelines as well. So let us discuss what we have in the rest of the session. Let me welcome Dr. Somnath Gupta Garu, who is our senior physician and diabetologist from Yashoda Hospital, Hitec City. And let me also welcome Shida, the super fast dynamic senior nurse from critical care unit. I welcome you all and start sharing the slide, Shida. So, sir, the first question we would like to understand from you is, what are some heat related issues you are witnessing since the heat surge is high? And do patients are able to recognize these heat symptoms?
First thing is, as the temperature approaching more than 40, we see during mainly in India, April and May are more vulnerable for this heat related issues. One of the things which we see heat related issues, a lot of people say that we have been having a lot of heat generating from our body. We call this as a heat exhaustion, and if at all it is not addressed and neglected, and it can lead to heat stroke. So heat exhaustion, everybody discuss about the symptoms, but they don't know that actually it is the heat exhaustion. They describe that they're feeling fatigue in the summers, they feel headaches, they feel having some kind of dizziness. They say that they're having nausea, they say that abdominal discomfort, a kind of weakness, tiredness, fatigue, and excessive sweatings as well as moist skin, a kind of high heart rate. These are all the symptoms which we see in this heat exhaustion kind of. But a lot of people neglect this heat exhaustion. They think that it is just a feeling that they didn't have a proper sleep, they didn't take proper diet. But actually, this is because of the hot sunlight exposure. So not hydrating well during these seasons can lead to heat exhaustion. Yes. And a lot of people neglect, they don't read this, they just go on with this work. And this can cause heat stroke, where the temperature is very high during this heat stroke. Our body temperatures may rise up to 104 and it will not come down. And they can have the fainting spells because of this high temperatures. The blood pressure falls down and the heart rate increases so much severely that they may go into comatose state in few and requires high hospital admissions. Morbidity and mortality can also increase.
So let us discuss what we have in the rest of the session. Shilda, would you like to share the first slide? Go to the first slide and you can start. Yes, you can start. Yeah.
Hi everyone, it's me Shilda. Today I'm going to present regarding the heat stroke. So let's discuss regarding the heat stress and heat related illness. It refers to the heat condition that occurs when the body is unable to regulate its temperature properly due to the exposure of high temperature and humidity. Once the person is exposed to the sunlight, he can experience like mild to severe heat cramps, heat exhaustion, and worse that will be not treated properly will be leading to a condition known as heat stroke.
So, sir, as you said that heat exhaustions, everybody's experience, and many of the OP admissions are getting higher. And can heat exhaustion progress into heat stroke if not identified and treated properly?
Yeah, absolutely. For example, we neglect a heat exhaustion for at least like few hours to a day. Patient is having comorbidities like age more than 65 years, or people who are vulnerable like children's,
yes,
and who have comorbidities like cardiac issues, diabetes, or liver disease or kidney diseases. They are more prone to easily this heat exhaustion can convert into heat strokes. So heat exhaustion is mild symptomatic, but heat stroke is an emergency. And there are a lot of morbidities and mortalities and increased duration of hospital expenses. All these things happen because of the heat strokes. And it is immediately to treat heat exhaustion and hydrating well, using some lightweight clothes, as well as some other precautions, keeping in the sunshade areas, as well as not to expose to high temperatures. And a lot of precautions to be maintained to heat exhaustion to get converted into heat stroke. If at all it gets into heat stroke, there's no other outpatient treatment and no other treatment at home. He requires immediate hospitalization, immediate measures to prevent or to at least to reduce the complications arise because of the heat stroke.
Yes, yes.
Let's understand heat stress condition in a short way. As I have shown in this figure, the main part of our body, the brain, in which the hypothalamus is located, the main function of the hypothalamus is like thermal regulation, in which when the heat stroke occurs, the function of the hypothalamus will be delayed. When heat exertion occurs, or the heat waves occur, or the heat stress, this all will be like a condition in which the immediate treatment is required. When it is delayed, it can be leading to a condition known as heat stroke. In this, we can see like hypothermia, electrolyte imbalances, syncope, dehydration, and even the renal issues.
So I think, sir, these are the very major clinical symptoms of which a patient presents to your OP or to the ICU admission, I think. Yes.
So we usually see with few complications like multi-organ involvements because of these heat strokes, like dehydration causes low blood pressures and high heart rates. Can because of patient land into pre-renal failure, like urine output shutdown, as well as increased creatinine levels. You may have these brain-related issues in terms of they may throw scissors, they may have fits, they may be going into confusion, and you land into coma also. A lot of people may go into irreversible damage because of these organ failures. And it is one of the complications which need to be treated as soon as possible. Otherwise, he may land into irreversible failures.
Just because they are not able to identify and seek medical attention. Yes.
Now, let's see regarding the heat stroke, how to recognize it and how to act quickly. As we all know, heat stroke is a life-threatening condition in which the body temperature will be more than 104, in which the signs and symptoms will be like confusion, disorientation, tachycardia, seizures, and even the person can go into loss of consciousness.
Sir, so does heat stroke have a specific duration or time frame as we practice door to needle or, the immediate medical attention to the hospital? So what is your take on this?
So when we talk about heat exhaustion and heat stroke in terms of how much time duration exposure these symptoms can occur, or how much time that heat exhaustion and heat converts into heat stroke, and how urgent we need to attend heat stroke, there's no particular time frame. It depends on the individual susceptibility. Like few people have been regularly exposed to these sunlights and they are not vulnerable so much, but few people, they don't regularly exposed to these hot sunlights, those are more vulnerable. And similarly, our fluid status are also matters. Like when we hydrate well and exposed to sunlight, we have a longer these heat strokes or heat exhaustion can occur when longer duration of exposures. Similarly, people who are in a vulnerable age group, like children or age more than 65 years, who having comorbidities like diabetes, a kind of heart diseases, kidney or liver diseases, they are more vulnerable, and small duration of exposures can easily convert them into having symptoms of heat exhaustion, and they can convert into heat stroke, and the heat stroke symptoms which will go into irreversible organ damage for these people so fast that even before bringing to the hospital, the patient may land into any organ failures. So it depends on the fluid status, it depends on the comorbidities, it depends on the age group, it depends on how frequently you exposed to sunlight and how severe hard temperatures you expose. There is the different criteria which we need to take into consideration when we discuss about the time duration of the onset of the symptoms.
Yes. Yeah.
So now let's discuss regarding the managing life-threatening hypothermia, one of the leading cause of the preventable death. Once the hypothermia is occurred, the duration of the hypothermia matters a lot. Rapid reduction of the core temperature matters, and the immediate treatment is required for that. So that decrease the chance of irreversible injury. Adequate hydration is mandatory, and hypothermia to be taken priority, and treatment is required for this.
So when we talk about hyperthermia, I think this is one of the danger alert which one should be very careful about, because again, otherwise it is going to take a toll on the health. So hyperthermia and the cooling measures in the setup of ICU. So is this, specifically which happens with the heat stroke? So.
Yeah, so whenever the patient lands into hyperthermia, mainly when the body temperature rises more than 104 in heat strokes, so we need to cool that body temperature first. The first priority is cool the body temperature. We need to hydrate the patient well, give him good amount of adequate IV fluids. We can give some cold salines. We can use some ice packs. We can use some cold blankets. The primary target is to reduce the body temperature to avoid irreversible damage to the multi-organs. So by cooling the temperature by using different methods, like before coming to the hospital itself, we can use some cold towels or cold blankets. We can cover him before coming to the hospital. In the hospital, we can immediately reduce the temperature by using cold salines, as well as cover him with the ice blankets or ice packs. This will help in reducing the temperature, can avoid organ damages.
Yes. And we get to see these hyperthermic patients, if they are at home, they take head bath. They keep, drenching their heads, and they keep cooling their body by taking a lot of time, this drape of cold salines and all. Yes.
So next we are going to discuss regarding heat cramps due to the heat waves and extreme heat. Once the person is exposed to the extreme sunlight or the extreme heat, he can experience a symptom like muscle cramps. That is due to because his body is dehydrated and adequate imbalance is not there in his body.
So is it normal for people or professionals doing field duty or outdoor work? So, and they experience, I think, most of the time heat exhaustion and likely to have this heat cramps. So when they should seek the medical, attention, like maybe the person comes and sleeps in the night, and suddenly they just come with, they complain of a lot of body aches and myalgias and all. So what is your, advice on?
Usually, there are few warning signs before sudden onset of the symptoms, which we neglect usually, like police or people who usually work in hot sunlight exposures on a regular basis. They may be experiencing some symptoms which they neglect. These are the warning signs, like they may be having mild headaches,
Yes.
and they may be having body pains, mainly myalgias, in terms of cough, muscle cramps. These, as well as they may be having a kind of decreased urination, a bit of dark colored urine. They may be having a kind of disturbed sleep. They may be having a kind of weakness, tiredness, fatigue, which can be unexplained. So these are all the usual symptoms which we neglect. We think that it can be because of overstrain today, working throughout continuously, because of no proper sleep prior day, as well as food on a not on a regular basis. These are the things which we miscommunicate ourselves, and we think that these are not the some other warning signs. Actually, if these warning signs are addressed properly, we hydrate well during that time. We take a lot of fluids, avoid exposures, trying to avoid exposures as much as possible. At least cover up ourselves with a light clothes, as well as drench ourselves with some cold blankets during that time, cold towels, using cold towels. These are the different things which we need to do to avoid or prevent further complications. And when we find the warning signs, immediately approach a doctor as soon as possible. At least, like if the warning signs are not coming down in a day, you need to approach a doctor as soon as possible to avoid the complications. At least that can help in at least giving a proper education by the doctor, bringing some preventive measures like hydrating well as using some cold blankets or cold towels. These are the different things which we get to know immediately after approaching a doctor.
Yes. So we keep assuming that these are the normal part of activities of daily living, and we tend to ignore. Yes.
Now we are going to discuss regarding the heat exhaustion. It occurs when the body overheats due to the exposure to the high temperature or the humidity. The symptoms which will be seeing like heavy sweating will be there, dizziness will be there, nausea, headache, decreased urine output, as sir has told. And this condition all we can see in the patient who is getting heat exhaustion.
So is, sir, the heat exhaustion clinical condition is a criteria for admission, or maybe it is only, admission criteria when they have the severe symptoms, like it is mentioned, Shida is mentioning that decreased urine output and severe headache and dizziness, etc.
Heat exhaustion is one of the warning sign, or if neglected, can convert into heat stroke. So heat exhaustion need to be can be addressed at home by proper hydration, as I said prior, by using some kind of preventive measures like to cold blankets and these things. Wearing lightweight clothes, as well as hydration is one of the main key.
Yes.
But if few people in heat exhaustion, like as vulnerable age people, children, as well as age-old patients like more than 65 years, as well as having some comorbidities,
Yes.
it is better keeping in hospital or at least in casualty and hydrating well, or at least trying to avoid preventing them to heat stroke.
Yes.
But normal population regularly, if they are into heat exhaustion, they're having some symptoms which looks like to be heat exhaustion. We can manage at home by asking them to take a lot of fluids like ORS, coconut water, buttermilk, soup, juices, these kind of hydrating them well, at least asking them to take 3 to 4 liters for fluids per day. and avoiding exposure to hot sunlight, and reducing the body temperature by using cold towels or drenching them into ice packs or something.
Yes.
Now, let's discuss regarding what is heat syncope. From the word itself, it is indicating like heat collapse, which is characterized by fainting. In this condition, the person can feel like a dizziness and hypotension is the main thing which we can see in this, and nausea can be experienced in this state. So immediate management is required, otherwise the patient can collapse.
So heat syncope is again, I think the classification itself describes after heat stroke or syncope is the mimic characteristics, I think.
When a patient is already in heat stroke, as we know that the temperature is more than 104 or somewhere 40 degrees Celsius, automatically, as we know, 1 degree rise in body temperature will cause dehydration at least 500 ml in 1 hour. Similarly, it can increase our heartbeat to 15 beats per minute. So increasing the heartbeat similarly, as well as reducing our body fluids, can ourselves lead into hypotension or low blood pressures, both systolic and diastolic, which can decrease blood circulation to the brain, and patient can finally go into syncopal attack. So this is like a kind of collapse, which we call fainting spells can occur, may go to have fits, they throw into scissors, and they may lose their consciousness and go into comatose stage because of this low blood pressures and dehydration, finally syncope leading to these kind of symptoms.
Yes.
Next, let's discuss regarding the rapid evaluation and the nursing care. First and foremost thing of the nursing care is like assess the patient vital signs and GCS as well. This is the first mandatory thing. And next, check for the signs of dehydration, whether the patient is having any dry mucous membrane, the texture of the skin to be assessed, whether any dryness is reduced. Main thing, checking of the urine output, the color of the urine and the amount of the urine. And initiate rapid cooling measures, as sir has explained, like a cold compress and the saline we can give through the IV as well as through the RT. So the body temperature can be controlled, as all these methods has been explained by sir. And using isotonic solutions such as NS or the electrolyte corrections to be maintained in this state.
So I think, sir, when we talk about the ICU criteria and safe recovery for these group of patients, I think you will also agree that these core interventions are very important. Or would you like to add something, as well?
Yeah. First, before assessing, before giving the first aid, we need to assess the patient regarding how is this fluid status, how is the dehydration status. We need to monitor his urine output, whether the eyes are sunken, how is the oral tongue, whether mucosa is dried up. And similarly, we used to see the capillary refill, whether how much is the capillary refill, whether it is refilling immediately, and similarly, how is the skin turgor, and how is the level of consciousness, whether he can be able, he's confused state, he is conscious enough, and all these things to be measured, and then we can give him cold saline fluid resuscitations as well as isotonic salines. Similarly, raising his legs to improve his blood pressures. Different measures we need to see what we usually do in sepsis, or usually when we do in dehydration conditions, we need to resuscitate him immediately during the first hour of coming to the casualty.
Yes. Yeah.
Next, we will discuss regarding the potential drawbacks which is occurring due to the heat stroke. The main and foremost thing is like electrolyte imbalances. We can see like hypernatremia, hypokalemia, rhabdomyolysis. This all to be corrected in the initial state. If not, it can be a life-threatening condition. Hyperkalemia, hyponatremia to be corrected immediately as soon as possible.
So I think we are going to be ending the session. You can share the 10th slide. And I think, sir, you will also agree with this preventive measures, as you said, stay indoor and keep yourself hydrating, and seek shade or cool environments if you're outdoor, all that. And so we would like to also understand the role of ORS. The oral rehydration solutions are just fading off now in this 2024 concept. So what is your advice to the person who is at home? Can they take this
Absolutely.
solution?
For us, when the patient have a warning signs, the best fluid to resuscitate during at home is ORS, oral rehydration solution. As we know, it is rich of electrolytes with dextrose as well as fluid. So these are the three things which requires when a patient lands into heat exhaustion. So there will be, as we know, when the heat exhaustion, the patient gets dehydrated, not only fluid loss, but also electrolyte loss. And electrolytes is nothing but sodium and potassium. And these losses can also lead to organ failures. Like heart is one of the vulnerable organs, kidneys are vulnerable organs because of the electrolyte imbalances. So patient may land into seizures because of hyponatremia, as well as hypokalemia can also cause abdominal bowel movement disturbances. Similarly, can also disturb our heart. So electrolyte imbalances, and not only fluid resuscitation, electrolyte correction is also important. So ORS has combination of all these electrolytes as well as fluids. So this is one of the better fluid resuscitations of all the fluids during this dehydration, mainly during high temperatures or during when we face symptoms of heat exhaustion.
So one thing I would like to ask from my end, as I'm just getting a doubt, a concept like when patients, this heat stroke or heat exhaustion period is over, I think the automatic, if at all patient had contracted seizures, that also gets resolved, I guess.
Yeah, absolutely.
Yeah, so yes, so next slide again. And I think, yes, we can always avoid self-treatment with over-the-counter medication as we get to see somebody is experiencing some fatigue or some heat exhaustion. They just treat themselves with OTC medications, and that's how the silent signs are being, missed when they, and it is very late to come to the hospital.
True, a lot of people do during this heat strokes, heat exhaustion, like they have high temperatures. They feel that there is some infection and they start taking paracetamols or over antibiotics. And this, the high temperatures during this heat stroke within our body is completely different from the infection high temperatures. Hyperthermia because of infections and hyperthermia because of heat stroke is completely different. Managing like infection, giving paracetamols or giving antibiotics will not help in these infections and may worsen ourselves. So it is better to approach when there are warning signs to doctor rather than self-treating.
And so you all can join us. Next slide, yeah, Shilda. So we have seen your very recent current talks as we, keep listening to your talks. Refer to our short health talk sessions as well for the more update. We end the session. Thank you, sir, for your valuable time, and thank you, Shilda. We end the session.
Thank you, ma'am.